This is case study 2 for class 638 from Ball State University. My name is Aspen Morgan. The client profile today, we will use the name as Kyle Adams. He is a 6-year-old little boy with an autism diagnosis. The behavior of concern is aggression. Some potential functions of behavior can be access, escape, and attention. For operant extinction, when describing operant extinction for B9 of the task list, we know that operant extinction is withholding all reinforcement from a previously reinforced behavior maintained by its consequences. Extinction should be considered as part of a comprehensive treatment package involving teaching replacement skills, and that is what we have. Attention by tapping the targeted person on the shoulder and then asking them for attention. Intervention and assessment. The intervention was selected to decrease inappropriate behaviors such as aggression of running into people to gain their attention. The type of assessment used was through a basic questionnaire from therapists and parents. And then also a functional behavior assessment was completed. Socially mediated, B7. So for this, the question was, is the function of behavior, can you determine it as being socially mediated? For this case study, yes, the function of behavior was determined to be socially mediated. And because of this, it was based on the assessment results. The behavioral function was identified as attention. Now let's go on to reinforcement. Was it unconditioned, conditioned, or generalized? When the patient gained it is walking up to them, tapping their shoulder, and asking for attention or asking for them to play with them. We had set it as a conditioned reinforcer that the technician gives the client attention once he has gained attention appropriately. So again, walking up to them, tapping them on the shoulder, and then asking them for attention instead of just running into them. And lastly, we will talk about stimulus control, which is B10 on the task list. So the last question for case study 2 was, how was stimulus control, B10, considered in the development and implementation of an intervention? So by first modeling how to gain attention appropriately. So the therapist modeled how he needs to gain attention. So he watched, and that technician was the one that walked up to a person, tapped them on the shoulder, and asked for attention or asked them to do something with him. Then we would have him do it after it was modeled to practice working on him doing it eventually doing it independently. Then secondly, we stopped modeling and we started doing gesture prompts for the client to tap on the person's shoulder to gain their attention. And after this was mastered, we moved on to the goal of only reinforcing when he would independently walk up to the person and then tap them on the shoulder and gain attention that way. Thank you.